Well, first of all, thank you all so much for being here. I'm San Francisco Mayor London Breed, and I just want to start this press conference by really acknowledging what happened in Atlanta, Georgia. Many of you heard about the uh, Asian American women who were killed, unfortunately, and targeted in Atlanta. And I've reached out to Mayor Lance Bottoms to, of course, express our condolences. And as many of you know, here in San Francisco, we have seen a rise in hate crimes against our elderly Asian community. And I want to make it clear that we won't tolerate it. San Francisco will continue to support and uplift our Asian community. At the beginning of this pandemic, the xenophobia and discrimination against our Asian community has been really horrible, and we are all struggling here. Our city has been impacted tremendously. Now is not the time to continue to accept hate against a particular community. Now is the time to uplift and to support and to embrace. We are almost in a good place 1 year later, after the city had to make one of the hardest decisions that we've ever had to make, to shut down to save lives, when we didn't even understand exactly what this virus meant and how it could impact us. But you trusted the leadership of the city. You trusted the Department of Public Health. You trusted the data and the science. We didn't completely understand it. I know I didn't. But I was grateful. I was grateful that San Francisco in the beginning, although criticized for our quick action, is now being praised throughout the country for saving thousands of lives. But there was sacrifice. There was sacrifice because so many people did lose their lives. There were people who did not make it through this pandemic. There were businesses that had been around since before I was born that did not make it through this pandemic. There were people who struggled because of the decision we had to make. We recognize our children have suffered, our seniors in isolation have suffered, our mental health has suffered. But San Francisco, we've been in this place before. We've struggled before. There was a pandemic in this city 100 years ago. There was an earthquake in 1906. There was an earthquake in 1989. There were things that we've experienced before, and we came back. When you think about it, we came back because we didn't drown in our despair. We took the tragedy, we took those experiences, and we used those experiences, that tragedy, to make San Francisco a better city. When you think about it, the Embarcadero, some of us remember that freeway that was down there. Remember the freeway on-ramp in the Fillmore Western Addition Hayes Valley community that used to be on Gulf and Turk. Those areas used to be really dark because of the shadows of the freeway and the noise and the pollution. We took a tragedy in the '89 earthquake and created an opportunity to make Embarcadero and the city's waterfront one of the best anywhere. And we will do the same with COVID-19. We will take what we have experienced this past year and use it as an opportunity to address issues around inequities that have only been lifted higher as a result of this pandemic. But let me tell you another thing. We should be proud of what we've been able to do. When this city shut down a year ago, there were still people who had to go to work. There were people at San Francisco General who had to sacrifice their lives. When you look at the data in the city and county of San Francisco of the workforce and who contracted the virus at some of the highest rates, it was people who work for the Department of Public Health. They put their lives on the line in order to take care of those who were sick. It was our Muni drivers, our grocery store clerks, our police officers, our firefighters. Our essential workforce in this city had no choice but to show up because we were counting on them. Today, as we think about that year, and all the work that we've had to put in order to get to this place where we are today, I'm grateful. I'm grateful to the workforce here in San Francisco. I'm grateful to the doctors and the nurses and the clinicians and the janitors and the HR representatives and all of the people who still showed up to work every single day. I am grateful. I'm grateful to the nonprofit organizations and the folks who served food and provided rental assistance and made sure that those who were suffering with COVID, who could not collect unemployment, that they had the resources they need. When you think about all we've done in this city, we built a testing operation from scratch. Mary Ellen, leader of the emergency response in this city, we built testing capacities from scratch. We had to pull together resources and PPE. We remember those times when folks were just doing everything they could to get by and in need of N95 mask and other things in order to serve the people here at San Francisco General. But look at where we are now. 33% of San Franciscans over the age of 16 have been vaccinated. 71% of those over the age of 65, our most vulnerable population, vaccinated. Yes, we're still in this pandemic. I see Dr. Colfax shaking right now, like, make sure you remind them we're still in the midst of a pandemic. But we've conducted over 1.6 million tests since the beginning of this. Almost 10,000 people were served through our hotel programs. 10.5 million meals and 2 million bags of groceries. The work continued. We came together. We supported people in San Francisco. I remember early on when I received a note from my neighbor that said, if you need someone to go grocery shopping, you need someone to pick up medication, you need someone to do anything, or you just need somebody to talk to, here's my email and my phone number. That's San Francisco right there. That's what we do. Even despite the challenges that we face, we rose to the occasion and we took care of one another. We all did our part, and it was hard. We didn't get to see our loved ones. We had to separate. Our kids are still struggling to get back into school. We sacrificed, and we made it through. We just need a little bit more, just a little bit more. So as we look back on this past year, what I'm going to take from this is what an amazing future we have, and how San Francisco is going to continue to be more aggressive now than it has ever been to address the inequities that exist in our city around healthcare, around housing, around unemployment. How San Francisco is going to do everything it can to pour in resources in our small businesses and keep our shared spaces program, our parklets, where our businesses and our restaurants can continue to get by so that they could eventually get back on their feet. What I'm looking forward to is a San Francisco, well, now, as much as my family drives me crazy, I miss them, and I'll probably spend a little bit more time with them as a result of this. And I think a lot of you feel the same way about your family and your friends, a newfound appreciation for one another, for what we've all been through together. So I know it's been hard, but there is hope. There is hope for a better future, because out of those ashes, we will emerge stronger. We will emerge better as a city because we are still here and we stand in solidarity with one another, getting through this crisis. So thank you to those who have sacrificed so much. The healthcare workers who couldn't go home and had to stay at hotel rooms away from their families and even their kids. The police officers, the firefighters, and as I said, the people who still showed up at those grocery stores and dealt with us complaining about the price of something that we saw that was different on the shelves versus what it rang up when we got to the counter. The nonprofit agencies that, as I said, serve the food and the resources, the folks who help with the homeless and worked at these hotels, what we had to do to empty our shelters. So much work, so much sacrifice. And I feel good. I feel good, not just because I was vaccinated yesterday. I feel good because I see the city coming alive again. So as we begin to reopen 1 year later, let's just remember all we sacrificed, and let's also appreciate all that life will bring us in the future as we come out of this pandemic, because it was worth it. It was worth it. 448 people tragically lost their lives in San Francisco. But you also have to understand, San Francisco is one of the densest cities in the country. And we had one of the lowest death rates of any major city in the country. We were a model for this response. And it has everything to do with all of you. People were wondering, well, how did you do that in San Francisco? It wasn't just because we shut down early. It was because we have some of the best healthcare professionals anywhere. If you get sick or get in trouble or anything happens to you in San Francisco, this is where you want to be, at San Francisco General. Because the likelihood that your life will be saved is more likely here than I think anywhere else in the world. And we all know that. So today we celebrate, we remember, we get excited about the future, and we show one another support because we're all in this together. We remember that all of us are sacrificing, all of us are dealing with something. And as we begin to reopen our city, Dr. Colfax, hopefully sooner rather than later, Dr. Colfax doesn't want us to have any fun. He's like, well, I know the state said we can do this, but unfortunately, I'm going to hold off. But I did also say to you, Dr. Colfax, that I heard Dr. Fauci said, let's not move too fast. And this has been one of the most conservative Department of Public Health departments anywhere. And so we do appreciate that because it has made a difference. So thank you to our essential workers. Thank you to the San Franciscans that sacrificed. Thank you to everyone who will continue to do their part. And there will be a time where we will be able to come together again and actually talk without wearing a mask. And I am looking forward to the day when that happens. Thank you all so much for being here. And with that, I want to introduce Dr. Grant Colfax.
Well, good morning, everybody, and thank you, Madame Mayor, for your brave and bold leadership throughout this pandemic. The decisions you've made have saved countless lives. Your support for the Public Health Department
Decisions I was forced to make.
and the decisions you were forced to make. Your support for okay, I'll loosen up. All right. Your support deep into the nights of the discussions that we had, and the decisions you made have indeed saved countless lives and helped the city weather the very worst of the pandemic. And I have to say, Mayor, when this is over, I'm looking forward to a big party and dancing with you and shouting with joy and raising our hands and celebrating that we made it through this. And also, I want to take a moment to acknowledge the year of pain and suffering for so many, including the nearly 450 San Franciscans who have lost their lives to COVID-19 this year. My condolences to their families and their loved ones. And standing here today with you, Mayor, and my fellow department heads is a profound and emotional moment for me. As some of you know, I came to San Francisco in the early 90s as a resident here at this very hospital to fight HIV/AIDS, which, as we also know, has unfortunately claimed thousands of lives in San Francisco. And as we have seen with COVID-19, exploits the social, cultural, and economic fault lines of our society and brings more harm to people of color. If you had told me then, on Ward 5A in the old hospital, the HIV ward, that we were pioneering the playbook to fight COVID-19 and to slow a pandemic 30 years later, I may not have believed you, but here we are. And while this has been an incredibly challenging year, it has also been filled with moments of hope and even optimism. For me, the moments that will always stick with me are when, after the decision to shelter in place, those few weeks when we actually saw the curve flatten, and I remember people telling me it's happening, and it took me some time, and finally I was able to say to the mayor with confidence, we have flattened the curve. That's when we knew that interventions like social distancing, limiting gatherings and masking, we could slow the spread. We didn't know that at the time. And we showed that San Francisco could do this together. And then there was the morning that I read about the results of the first vaccine trial. And when the mayor asked me early on when we'd have a vaccine for this, I told her it would be a long time. And I was wrong. And I am so glad that I was wrong on this. As someone who started working at DPH, working on vaccine trials for HIV/AIDS, for which we still have no effective vaccine, it was with a profound sense of joy and hope that within a year, perhaps the fastest timeline in history, we would be able to protect people from this disease. And walking in here today, you see the lines of people getting their vaccine. And now we have not just one, but 3 vaccines that are highly effective and safe in preventing death and hospitalizations from COVID-19. And I'll never forget the day, December 16th, that we administered the first vaccines here in San Francisco. The milestones I've described have been hard won, and so much of our progress is owed to the incredible people of this magnificent city. Just like in the early days of HIV/AIDS, it's San Francisco's spirit of innovation, its compassion, and its refusal not to stand idle when the federal government failed in its leadership to make so much of a difference. As the mayor said, our COVID-19 death rate is among the lowest in the nation. I could not be more proud of what we've accomplished together. Another legacy of the HIV epidemic is our public health department and its close, long-standing relationships with neighborhood clinics and community-based organizations, academic institutions, and other hospitals across our city. Our close collaboration from the outset enabled us to scale up programs and services quicker as we wrapped our arms around the city. And we have seen this virus take hold in communities where people have to leave their homes for work, increasing their exposure to COVID-19, and where people often live in large households that make it difficult to isolate. That is why, from the outset of the pandemic, the DPH and COVID Command, in collaboration with our partners, prioritized vulnerable populations in our emergency planning and response. We still have work to do, but we have come so far, and we can go even further together. To my colleagues at the Department of Public Health and at COVID Command, this year was transformative for so many of you who found yourselves in brand new roles where the learning curve and stakes were so high. Your compassion for and diligent work with communities who have long suffered due to systemic racism have raised the bar for supporting these communities in overcoming barriers to better health and economic outcomes. And you know, the other day, I saw a patient in clinic at our Positive Health program, the building adjacent, right here on campus. She was 65 and Latina and is an immigrant and living with HIV. Today, her HIV is well controlled on meds, but she contracted COVID and thankfully recovered. And in fact, the day I saw her, she had recently received her second dose of the vaccine. Her story is striking to me because she embodies San Francisco's own story of surviving 2 pandemics. Like so many of our residents, she is a testament to our resilience and to the compassionate care that people can get in this hospital and this city. There are so many people to thank, including my gratitude to all of those on the front lines this year. I do want to give special thanks to my colleagues, Dr. Navina Baba, Deputy Director of DPH, who has continued to hold so much during this pandemic. To Dr. Aragon, who has gone on to the state to be the health director, and for Dr. Susan Phillip, who has stepped up in the role of acting health officer, and Dr. Susan Ehrlich, CEO of this hospital, and her remarkable team. Thank you. And finally, I want us to invite us to think about the positive things that have come out of this pandemic. Maybe it's outdoor dining enlivening our commercial corridors, meeting your neighbors, or listening to an impromptu musical performance while strolling down our slow streets, or taking up a new hobby, or having a new pet join your family. And maybe it's a deeper appreciation for everyday things we used to take for granted. For me, it's having a party and dancing with others, and I look forward to getting back to those fun times, Mayor. Whatever it may be, as the light at the end of this tunnel shines brighter, let us carry forward the positive transformations from this year and carry on the work of making this city an even more beautiful and equitable place. And remember, mask on, stay strong, and get the vaccine when you're eligible. Thank you.
Thank you, Dr. Colfax. I'll believe it when I see it. He's been the one that I have to talk to every day, and he's always like, well, we have to do this, Mayor. And I'm like, why? I don't want to do that. And speaking of hobbies, I was, before this pandemic, I had 0 live anything in my place, and now I have like 31 plants. I don't know if any of you have taken up other hobbies, but I even nurse them back to health. It's kind of crazy, but they're my babies, and that's what I have, and I'm sticking to it. With that, I just want to just take this opportunity to really thank the Director of Emergency Management for the city. And when you talk about our response to COVID and how challenging it's been, it's not only been here at San Francisco General, but Moscone Center has been really ground zero in some ways for the emergency response. So many of our city employees who work in various departments, they showed up as disaster service workers from the library, from DPH and other places. And we embedded an equity team in this whole COVID response. So when we talk about lifting up testing sites and all the stuff we do, providing food and groceries and working with agencies and getting things done in the city, everything we had to do came out of this whole operation managed by this incredible woman, our Director of Emergency Management, Mary Ellen Carroll.
Good morning. Thank you, Mayor. It has been a year that has moved by so quickly and yet felt like an eternity. Through it all, we were led by so many shining points of light. One of the brightest ones you just heard from our Mayor London Breed. Mayor, I want to thank you, where are you? For your steadfast leadership and support, your vision, your resolve, and your compassion. It is what we all needed during this enduring crisis. And Dr. Colfax, thank you for your courage, your integrity, and your wisdom. I could not imagine a better partner to have during a global pandemic. We should also be grateful for our San Francisco residents and businesses who have endured longer than anyone could have imagined. Even when COVID fatigue settled in, and it has settled in, San Franciscans continued to do the right thing for each other. I also want to recognize that this year would have looked a whole lot different if it weren't for the thousands of healthcare workers, many of you represented here, our emergency services personnel, and our essential workers who continue to come to work and risk exposure to help our beloved city. On March 17th, a year ago, 2020, I was standing inside Moscone Center overlooking 3rd and Howard Street the day before the shelter-in-place order had been announced, and we moved from our very tightly packed, not very safe emergency operations center on Turk Street to Moscone Center. Outside, the streets were empty, and it was like every person, bicycle, scooter, and car had just disappeared. Inside, however, it was a completely different story. It was a hive buzzing with activity. We had veteran responders who had been working nonstop over the previous 2 months. And we also had hundreds of new, fresh faces. These were planners, election staffers, librarians, analysts, accountants, you name it, from other city departments who were activated as disaster service workers. Like the many people around me, I was feeling tired and a little unsure about this whole new world we were stepping into, but mostly I felt determined because we had work to do. Since that day, over 11,000 San Francisco public servants have banded together to develop and implement one of the most comprehensive and expansive local emergency response structures in the country. Together, and you've heard some of these numbers already, the COVID Command Center has administered more than 1.6 million tests, and we are at the top of the list per capita in this country for testing. Millions of bags of groceries and meals for food insecure San Franciscans, and we continue to do that. Thousands of alternative housing rooms for people who needed a place to safely isolate or quarantine, and for people who were experiencing homelessness to be able to shelter in place. We developed and disseminated more than 3 million multilingual health and safety posters, flyers, and fact sheets that you will find all over the city. We engaged and developed partnerships with our communities, and they have worked disproportionately with those populations disproportionately impacted by this pandemic. And we are now, I have the number 236,000 vaccines, but I'm sure that it is more than that at this time. As we look back on all that we have accomplished, we need to remember why this work matters so much. And last week, a staff member of mine who is working at a vaccine site shared the following story with me. An older couple was sitting in the post-vaccine observation area, and they were holding hands, and they were both crying. They had tears streaming down their faces. Ellie, the staff person, went over to ask if everything was okay. They smiled through their tears and said their grandchildren were born during this past year, during the pandemic. And after an eternity of Zoom calls and very socially distanced visits, they were finally going to be able to hold those grandchildren close. So to all the essential workers that have struggled and sacrificed, your work means something to this couple and to the nearly 1 million people we share the city with. And so as we continue to vaccinate, to reopen, and set off on our long road to recovery, we remain determined. There's still work to do, but in this past year, we've all grown smarter and definitely closer. And like the phoenix that is the symbol of the city, and as the mayor said, we will rise from the ashes again. Thank you.
Thank you, Mary Ellen. My name is Dr. Gabriel Ortiz. I'm here on behalf of our wonderful staff here at Zuckerberg San Francisco General Hospital and Trauma Center to just share a few words from the perspective of our essential workers. Firstly, just want to thank everyone who spoke up here today. I think that this is an incredible milestone. And so this is quite a huge honor to be able to share a few reflections. I think my message in this kind of thinking about a 1-year milestone of this pandemic is really some of the things that Mayor London Breed already touched upon. Remembrance in terms of everything that we've gone through, the resilience that it took to get to where we are today. Deep gratitude, which I think really resonated with me as our mayor spoke, and hope in terms of where we are right now. From the early days of not knowing what we were up against, to the amazing professionalism and teamwork, to the sadness of seeing our Latinx communities disproportionately impacted by this pandemic, to the stress in terms of addressing second and third surges of cases here at Zuckerberg San Francisco General. This year has been a big challenge for our clinical teams and for our community. And I remember the tears. I remember tears shed due to facing so many unknowns related to this new virus. I remember the tears shed after a long day of work when staff were coming and asking questions about how we were planning to ration our supplies. I remember the fears of not knowing how bad each surge was going to be and wondering if we would see the overwhelming floods seen in other parts of our country and our world. And of course, I remember the tears of joy, pure joy, in sending our patients home to be reunited with loved ones, sometimes after many months of battling through illness here at our hospital. Very proud to say we've cared for over 800 patients who have been infected during this COVID-19 pandemic. And this accomplishment is a tribute to all of our teams. and serves as a source of pride for me and for all of us here at ZSFG. So on this 1-year milestone, the thing that I feel most is what the mayor mentioned. It's gratitude. I'm deeply grateful for our hospital leadership, and I'm deeply grateful to Mayor London Breed and her team for the proactive steps taken throughout the entire pandemic, especially 1 year ago at the onset. Because of all of the swift actions, we have grandmothers and grandfathers. We have mothers and fathers, sisters and brothers, friends and loved ones who are here with us today. To our staff here at ZSFG, I'm grateful to the entirety of the care teams and all of the hard work in addressing the needs of the community, and it's really taken every single one of our team members. I want to give a shout out to our greeter and screening staff at all of our campus entry points, to our cleaning and environmental services staff who've kept our hospitals clean, to our facility services and management staff, to our pharmacists, our food and nutrition services, to materials management who kept our PPE in stock, to our respiratory therapists and our rehab staff, our social workers, our eligibility workers, our clinical lab workers who've done all of our testing, to our care coordinators, our bed control operators, to our information technologists and informaticists who kept our electronic systems running, to our chaplain services, to our physicians, our nurse practitioners, our physician assistant teams, to infection control and infectious diseases, to our clerks, our patient care assistants, our certified nursing assistants, and last but certainly not least, our dedicated nursing staff who spent countless and countless of hours in patient rooms when we didn't know much about this virus, caring to make sure that folks could recover. Really, you are all some of the best clinical staff on the planet. And the survival rate, I'm very evidence-based, the survival rate of the patients, our COVID-19 infected patients, is just one additional shining example of the incredible work you all have performed. Thanks to all of you, over 94% of patients who came through these very hospital doors, we were successfully able to discharge back to the community to be home with their loved ones. So to close out, really, I just wanted to share a message to all of those that we serve in the community. We are hopeful, extremely hopeful, but the work is not done yet. We are here to serve each and every one of you, irrespective of race, creed, sexual orientation or gender identity, legal status or economic status. Keep masking, keep washing your hands, keep using common sense around gatherings, and maybe most importantly, vaccinate, which is like our real way out of this pandemic. I'm gonna say a few words in Spanish for our Latino community. Finalmente, como un mensaje a nuestra comunidad, tenemos esperanzas, pero el trabajo aún no está terminado. Estamos aquí para servirlos, independientemente de su raza, credo, orientación sexual o identidad o medios económicos. Siguen usando máscaras, lavándose las manos, manteniéndose la distancia física y vacúnense para protegerse. Your clinical providers here at ZSFG know the incredible toll this has taken on all of us, psychologically, physically, economically. We know the road to recovery has only just begun, but we see the light at the end of the tunnel. We are here and we are ready to support you. Estamos aquí para apoyarlos y hablamos español y muchos otros idiomas. As we work towards closing this chapter in our lives, really let's continue to work together and support each other so we can get to that light at the end of the tunnel as soon as we can. So thank you very much.
Thank you so much, Dr. Ortiz, for that profound message, and thank you so much for acknowledging, just how many people and how many departments have had to step up and serve at this hospital in particular to address this challenge. Thank you so much for the lives that you saved. I also just want to acknowledge that our Police Chief Bill Scott is joining us as well. Thank you, Chief Scott, for all that you and the San Francisco Police Department does to keep our city safe. It really does take a village, and a lot of the folks here are the village that has held itself together to take care of the people of San Francisco. You all should be so proud of what you've been able to accomplish. It has really made a difference. It has saved lives. And we're going to look back on this moment, and people are going to say, where were you during the 1920 global pandemic? And you're going to be able, what year? I told you I was up since 6 in the morning. So where were you during the 2020 global pandemic? And so many of you are going to have a story to tell, and how incredible this city was and how we stood together. Thank you for standing strong. Thank you all so much for your steadfast leadership and advocacy and work in keeping our city together. I'm so honored to represent you as the mayor of what I think is the most incredible city anywhere in the world. So as we reopen, let's get back to work. But we will celebrate soon. Thank you all so much. Take care.